Here's another one of those cases that makes you wonder, how was this person able to function with their feet in this condition? Check this out. As in all cases like this, I place this patient in a whirlpool foot bath for about 15 minutes to soften her skin up. That makes it much easier for her and much more comfortable, and makes it much easier for me to debride or remove the callus skin. That dark spot you see near the second toe is a mole. It's not any type of cancer or melanoma or anything else like that. She's had it most of her life and it hasn't changed size, shape, or color. So it's nothing to really be concerned about. I'm stopping right here for a quick second. If you look at the bottom of both of her feet, you'll notice that the surface is mostly calloused with the exception of the arch. That's because she has a high arch and she also has a C-shaped or kidney-shaped foot, what we call metatarsus adductus. This is from the 5 metatarsal bones moving slightly toward the inside, giving her foot that C shape. Moving on to the lateral side of the foot, we can see that the entire plantar surface, or what we call the volar skin, is involved. What's very interesting about this case is that the top of her feet, the skin on the top of her feet, is completely normal. There's no dryness, there's no patches, there's no scratches, nothing. So what this leads me to believe is that not only are there pressure issues on the bottom of this good lady's feet, but she may also have a fungal infection, or what we call tinea pedis. This area that looks like the gills on a fish are called fissures. And this is the most difficult area to treat in a case like this. We have to be sure that we're removing the callus carefully so that we don't injure the patient with a blade. Also, in this case, there's callus overlying the fissure as well as the fissure itself. So we got to be even extra careful because we have to deal with it from multiple angles, as you can see that I'm doing here. I'm coming from the top, I'm coming from the side, I'm coming from underneath, so I can get as much of that skin down and then remove as much of that skin from the fissure to help it be more comfortable for the patient when we're done, and so she can walk pain-free. See how this is going here? Now you can see the fissures really coming through. And this is usually or often my favorite part of this procedure. Again, the hands have to be very careful. You don't want to have the blade in the wrong direction or the wrong angle because it's easy to cut somebody. And believe me, I can tell you how easy it is because I have cut people before. It happens in the best of hands. But, you know, after doing this for a long period of time, we learn how to do it to minimize that risk. As you can see, in her left foot, she has the exact same pattern that she has on her right foot. We call that a mirror image pattern. The same forces are acting equally on both feet. In this case, she has a very thick skin in the ball of her feet, along the lateral side, and of the heels. Again, not much involvement in the arch because of the highness of the arch, and she has that metatarsus adductus on this left foot, just like she has on the right. That's why we are seeing similar things going on, and have to approach things in the same manner. Again, on the lateral side of the foot, we see the very same athlete's foot pattern that we saw on the right. Also, we see that the skin on the top of the foot is absolutely normal. No dryness, no scaling, no marks of any kind, no irritation that the patient has reported. It is one of the craziest things that you'll ever see, how this thing can only affect the sole of the feet. Now, this is my absolutely favorite part of this procedure, is taking care of the heels. The heels often have the thickest calluses, the most fissures, the most challenging work to do. And it's often most uncomfortable for the patient before they come in and get this treated. It's these heel issues that often bring the patients in. This occurs because the heel bears a lot of the weight when we walk and when we stand. When we take a step, the first part of the foot to hit the ground is the heel, so it bears the brunt of the weight. You do that hundreds, thousands of times a day, it's going to take its toll on some folks, especially in a patient like this lady, again, with the high arches, the metatarsus adductus, being on her feet all day. It's going to happen in some folks like this. Look at all of these fissures. There's so many of them, and they're going in a whole bunch of different directions. It's no wonder she was very uncomfortable. But fortunately, in this lady's case, as crazy as it seems, the calluses were so thick that the fissures did not extend all the way down to the normal skin. So there was no bleeding or anything like that, no weeping, no body fluids coming from the heel. So I was able to actually debride so much of that callus away that I was able to remove the fissures with the blade. Now, as I work on the left heel, you can still see the very thick skin, the multiple fissures. People often ask me in the comment section of my videos, when I'm doing this type of work with the blade, how do I know when to stop? How do I make sure I don't injure the patient? Again, we have to put this patient in whirlpool foot bath. That helps to soften the skin up, one, and two, that outer layer of dry skin and callus turns white. That's not the normal skin color. So it's easy to see where the abnormal skin is, and then as I continue to work the blade down, I can see the normal skin. So as I shave off those upper layers of callus, now I'm seeing the normal skin. I don't press as hard, so I don't go as deep, so I don't cut the patient. It takes years of practice to actually be able to do this and to do it well, and to not injure the patient and have a great outcome and to have a happy patient. So you make sure that the patient follows the direction and will want to come back for more care. This is not a one and done type of thing here. We got to keep seeing this patient at least every couple of months to make sure that things are getting under control. The callus is not getting as thick, and the patient is able to function more properly and function more comfortably, so that they will be more in tune and more motivated to keep coming back for treatment until it gets to the point where the patient can control it themselves. One of the funniest things you'll see in a case like this is the look on the patient's face when they see this collection of skin. Yeah, this is a lot, right? So patients get bewildered and they can't believe all of this was on their feet. Yeah, man, this is what went down in your case, so it goes down in a lot of cases. Also, I'm concerned that this is a fungal case. So I take a little bit of that collection of skin, put it in a vial, and send it off to the lab for testing for fungus. The final part of the treatment is smoothing the skin down. When using the blade, the skin can get a little bit uneven. So I use a sandpaper burr to smooth everything out. The water eliminates the friction, so it's not burning the patient or causing too much tickling. And the water also eliminates dust, so I don't have to worry about skin dust getting all over the place and everybody breathing it. There we have it, folks. A very difficult case with a great outcome. I'm very satisfied with it, and the patient is ecstatic. She's much more comfortable now, and she can function without pain. If you're having these type of issues, you don't have to suffer through them. See a podiatrist. If you're in the DC area, come on through. I'll get you all squared away. Thank you for watching this video. Like it with a big thumbs up and subscribe to the channel. Share this with your family and friends, especially those who have significant foot issues. But most importantly, take care of your feet.